I'd like to welcome all of you to our meeting today and to the webinar. And I want you to know that the Committee on Accounting for Socioeconomic Status in Medicare Payment Programs is pleased to host the workshop, and we want to thank the ASPE leadership for making this possible, and something that's very important to us too, as it is to others. So we're looking forward to today because today is an opportunity to stress the discussion of the centerpiece of the reports that lead to an assessment of what are crucial areas and what are areas in which we can gain success by bringing together social factors and medical care. While the National Academies Committee worked hard on the report series, and so many of you know, but maybe not all, that we were producing a report every 3 months. And you produce a report every 3 months, you have to submit it for review within about 6 weeks. And so that we're becoming expert at it, I think, or at least I hope so. Very much we're proud of those reports, but when you say, well, what's the work to be done in order to begin to really think through critically and implement what those reports talk about, that is the next step that goes beyond what the committee was engaged to do and engages all of you and others in the room and beyond. So today we're looking for, and I think we have, a much broader audience than what we had on the committee, that we have an audience that does include researchers, providers, plans, and hospitals, and advocates, as well as our colleagues in ASPE and CMS. And so we see this as enriching and building on the work that the committee did. So with that, I would like to turn to our colleagues in ASPE for a few words before we begin the day. John O'Brien, the Deputy Assistant Secretary for Health Policy in the Office of the Assistant Secretary of Planning and Evaluation at the Department of Health and Human Services, and Nancy DeLue, Associate Deputy Assistant Secretary for Health Policy. And so, please.
Well, thank you, Don, for the introduction, and thank you, Kathleen, for hosting us in this beautiful building. It's always a treat to be with fellow health policy nerds and get a picture with Einstein before it gets too warm. As Dr. Steinwachs said, my name is John O'Brien. I'm the Deputy Assistant Secretary for Health Policy in the Office of the Assistant Secretary for Planning and Evaluation, or affectionately known as ASPE. ASPE is the principal advisor to the Secretary of Health and Human Services on research and policy development. We provide the Secretary with research-based policy and solutions that enhance and protect the health and well-being of all Americans. So let me join Dr. Steinwachs in welcoming you to the National Academies of Medicine report series, Accounting for Social Risk Factors in Medicare Payment. ASPE aims to have the best research in order to ensure that we have the most effective policies and programs. And I think, Don, you hit the nail on the head when you talked about that important link and how those policies can deliver value for the American people. In the first report to Congress on social risk, the ASPE research team found that beneficiaries with social risk factors had worse outcomes on quality measures, and that dual enrollment status was a powerful predictor of poor health outcomes. In addition, providers that disproportionately served beneficiaries with social risk factors had worse performance on quality measures. And HHS is continuing to evaluate how best to incorporate these findings into policy and the work that we do. But as we discuss these and other research findings today, I most importantly want to thank the researchers and providers and experts and plans and others who've traveled around the country or over the internet to be here with us today. We're grateful to have you. Are eager to listen to you and learn from you, and thank you again for taking the time to be here and for your important work. And I also want to thank all of our federal colleagues and former federal colleagues and others who are here today. Thank you, and we appreciate all that you're doing and your year-round partnership in the work that we do together, and are, of course, very pleased that you can join us today. And I'm also really excited to see many members of the ASPE team here, all of whom care deeply about this topic and have led this work. And we look forward to continuing to work with you. So in addition to Nancy, with whom I couldn't live without, Steve Scheingold, Karen Joint, Robin Yabroff, Lena Chen, Rachel Zuckerman, Lak Wong Sampson, Wafa Tarazi, Sarah Lewis, and Arjit Sen Sharma. So thanks everybody for joining us, investing your time and skills to help produce strong, rigorous research and work that will inform us in the decades ahead. And I wish you a very successful meeting. Thank you.
Good morning. My name is Nancy DeLue. I'm John's deputy in the Office of Health Policy in ASPE. And I want to, as we start, this workshop is the capstone to our very successful contract with the National Academies. When Congress passed the M.P.A Act in October of 2014, they asked ASPE to review the evidence linking social risk factors with performance under Medicare's value-based purchasing programs, and they asked us to suggest strategies to remedy any concerns. One of our first steps was to reach out to the National Academies. I want to extend a very warm thank you to Don for chairing the committee, whose work over the past number of months has been enormously helpful to us. The series of reports from the National Academies, he noted how quickly we asked for those reports to be turned around, and we used those in the report to Congress that we released in December of last year. The reports that you wrote helped us frame our topics. For example, we embraced the term social risk factors rather than socioeconomic status. I know we'll talk more about what that means as the workshop moves forward today. Your reports helped us better understand the promise and the limitations in currently available data. The report that we released in December used currently available data. We'll talk a bit more about our work moving forward, looking for new sources of data. Your reports also, very importantly, provided examples of best practices in caring for vulnerable populations. We know that there are a number of participants both in the room and on the webinar who have much to teach us on that front. And I also want to thank other members of the committee, many of whom we'll hear from today, and the incomparable staff team led by Kathleen. After 2 years of work on this project, the first ASPE report, as I noted, was sent to Congress last December at the end of 2016. Today you'll hear some highlights from Karen Joint, who led our team on that report, and Rachel Zuckerman, a senior member of our team. The findings of our report and the reports from the National Academies Committee, they answer some of the questions about social risk, and they also identify many new questions, and we'll talk about some of those new questions in the workshop later today. We hope that the sessions will stimulate ongoing discussion, both today and in the days to come. Our second report to Congress is in the early stages. We welcome your thoughts both today and over the coming days as we move forward on that work. It's due to the Congress in October of 2019. Robin Yabroff, who you'll meet in a little bit, is leading our work on Study B. We call it Study B because that's the paragraph in the legislation that describes that report. So that's our shorthand for the second report. Robin will also be joined by Rachel. They'll talk about some of our plans for Study B. In this study, we'll be evaluating new data sources on social risk factors, such as wealth and living situation, that are available in some of the surveys of Medicare beneficiaries. We also hope to learn more about the relationship between social risk and health outcomes by examining factors like frailty and functional limitation. So my goal for the workshop today is to spark discussion, gather insights, and brainstorm with you about additional work as we try to move this field forward. We're grateful for your participation in the workshop, and we're eager to listen and learn. I want to thank you, just like John and Don did, for taking the time to being here with us today. And I'll turn the podium over to Melinda to get us going.